Thank you for tuning in to today's episode of Medical Device Global Market Access by Pure Global. Today, we're exploring a critical pathway for many MedTech manufacturers, leveraging European CE marking to gain market access in Australia. The Australian Therapeutic Goods Administration, or TGA, has a well-established framework that allows for the use of evidence from comparable overseas regulators. This significantly streamlines the registration process for companies that have already secured access to the European market. The cornerstone of this process is the manufacturer's evidence. Before you can apply to list a device on the Australian Register of Therapeutic Goods, or ARTG, you must submit proof to the TGA that your device has undergone an appropriate conformity assessment. For many, a valid CE certificate serves as this crucial piece of evidence. This can be a certificate issued under the new EU Medical Devices Regulation, MDR, or even a legacy certificate under the previous Medical Devices Directive, MDD, provided it remains valid under the MDR's transitional provisions. The TGA's device classification system, which includes classes 1, 2A, 2B, and 3, is nearly identical to the EU's. However, it is vital to confirm your device's classification according to Australian regulations. Any discrepancies can impact your application pathway and may trigger a mandatory audit. Once your manufacturer's evidence is accepted, a process that the TGA targets to complete within 15 working days, your Australian sponsor can submit the application for ARTG inclusion. While using a CE mark is an efficient route, it is not a simple guarantee of approval. The TGA retains the right to select any application for a non-mandatory audit to verify compliance with Australian requirements. Furthermore, certain higher-risk devices may be subject to a mandatory audit. A key development occurred in July 2021, when the TGA began accepting CE marking certificates for certain high-risk devices, specifically some Class III devices and Class IV IVDs, which previously required a full separate TGA conformity assessment. This change further harmonized the two systems. Regarding costs, the TGA operates on a cost recovery basis. This includes application fees and, where applicable, audit assessment fees. It's important to budget for these and note that the TGA announced a 4.7% increase in most fees, effective from July 1, 2024, to support its operations and new initiatives like the upcoming Unique Device Identification System. In summary, leveraging a CE mark is the most common and efficient pathway into the Australian market. The alignment on technical documentation, such as the clinical evaluation report, is a distinct advantage. However, success depends on a thorough understanding of TGA-specific requirements, proper classification, and careful preparation of your submission. If your company needs assistance navigating the TGA registration process or requires an Australian sponsor, the experts at Pure Global are here to help. Thank you for listening, and we'll see you next time.